Non-melanoma skin cancer is on the rise, and studies show that patients who get these types of cancers are at increased risk for not only more skin cancer, but for other potentially more serious cancers too. Joining us now to discuss is Wall Street Journal's Laura Landro. Hi, Laura.
Hi.
So, Laura, if you do get a non-melanoma skin cancer, what are the chances that you might get another type of cancer, whether it is melanoma or a second primary cancer?
Well, a lot of studies recently have shown that there is a much higher risk, and it ranges around different types of cancers. But you're at risk not only for your first, once you've had one non-melanoma skin cancer, and this would be basal cell carcinomas, squamous cell carcinomas, you're at risk for more of those. And, you talk to people who have had 60 procedures, getting a lot of things scraped off their skin, and it's not very pleasant. But you also are at higher risk for melanoma. If you've had a basal cell carcinoma, I think 40% chance of getting another one. And I think you're also very much at risk of melanoma itself. In women, it might be breast and lung cancer, and in men, it might be prostate cancer.
And how do these non-melanoma skin cancers that you mentioned, how do they form and what do they look like on the skin?
Not pretty. I mean, certainly, years of sun exposure is basically what they're linked to. And for baby boomers that are aging, those are those blistering sunburns that everybody got when they were pouring on baby oil and using their reflectors. No one was really talking about, skin cancer back in the 60s. And then you look now at younger women who are, doing tanning beds. So you've got older white males, aging baby boomers on the one hand. And then you've got these younger women who are, have been in the tanning beds. There's a lot of linkage to tanning parlors. And one of the things that you're seeing is more skin cancers that might start out as like a scrape that doesn't heal. It might be a mole that starts to look different. There are a lot of different things on your skin that as you start to see them changing or not healing, you really should be concerned about.
And who's most at risk for developing these types of cancers? If you have fair skin, does that make you maybe more at risk?
Fair skin is really bad, yes. Obviously, fair skin, light eyes, red hair, those are some of the people that are at the highest risk. Darker skins, more of a Mediterranean complexion. Minorities, African Americans might be at lesser risk, although they are seeing more skin cancers in all kinds of people. No one is not completely at some kind of risk. No one should be out there broiling in the sun like a steak,
And doctors that you've spoken to say it's all about prevention, right?
Right. I mean, people think, well, now that I've got this skin cancer, now that I've been all those years in the sun as a kid, I don't have to worry anymore. The damage is done. That's actually not true. The damage is cumulative. There's a lifetime risk of exposure, and you really have to be protecting yourself forever, especially if you've already had one. And that means hats, it means sunscreen, it means avoiding hours and hours in the sun. It means thinking about, looking at sunscreen protective clothing, which is out there now. And reapplying sunscreen is also, you go out and you do your sunscreen in the morning before you play golf, you're sweating it off in a couple of hours. You need to reapply.
All right, so lathering up the sunscreen, being safe and smart. Thank you, Laura, for joining us.